I'd like to introduce you to Ring. So we are a company with a very simple vision and mission. As individuals, we have a lot of information out there, a lot of which is inaccessible to us. So this is something that we're aiming to change. We're a young team, we're a startup. We started operations in 2022. We're based out in Bangsar South. But within those 2 short years, we have 2 amazing collaboration partners. The first, of course, is MDEC, who guides us, especially in terms with the incoming national data sharing policy. The second, of course, is University of Malaya, and we work very closely with their Faculty of Medicine in guiding us to ensure that the application we create is actually useful. So to sort of go into what Ring is, I'd like to bring up the concept of single patient, single electronic health record. So it's not a new concept, it's been something we've been talking about for many years now, but we haven't yet gotten there, right? But why is this important? So firstly, 3 questions to ask ourselves, and I know this room is full of doctors, so you're probably going to be able to answer this for yourselves. But for the most part, for the general public, the first question is, how many times do we go to see the doctor in our lifetime, right? The second is, how many different doctors do we see? In how many different clinics or hospitals, maybe even different states or countries, have we been to see the doctor? And the third is, well, tomorrow as an individual, if I wanted to make a more informed decision about my healthcare, or if I was about to go see a new doctor, maybe I moved countries, and that doctor would benefit from having my health history, right? Because as a sort of normal person, I'm unable to communicate that effectively to my doctor. How can I actually share that? Do I have that information at hand? And I mean, if we compare that to the rest of our lives, right? If I were to ask most people here today how much, where, and when your last transaction was, you can open up your mobile banking app, and in a couple of seconds, you could tell me. I could even ask you something completely random. Like if you went on holiday 3 years ago, what was the seat you sat on your flight? It may take you a minute or 2, but you'll probably find that in your Malaysia Airlines app, your AirAsia app, or your emails, right? But if I were to ask the general person on the street what the diagnosis of their last doctor's visit was, or what medicines they were prescribed in that visit, or going further back, what vaccines were you prescribed as a child? What are your next boosters? When are they due? Chances are we don't have that information at hand, right? So coming back to that idea of single patient, single electronic health record, what we thought to do was, well, why not let us as individuals, because this is important information to us, let us consolidate that information. We become we hold our own single electronic health record, right? So it doesn't matter where I go, which doctor I see, I have all that information with me. So the Ring platform helps you do that. It's a mobile app which you can download onto your smartphones, and the idea being that the doctors are able to transmit or share selected information, the information that is for the patient to see, across to the patient so that they can consolidate all of that information on their mobile devices. Now with that, not only do you store all of your records, but we can generate a healthcare summary on the application, which summarizes your whole lifetime of information into sort of single liners where if you or your doctor is a bit more curious or excited or wants to dig deeper, we can just, at a single tap it, more information comes up, right? Not only that, but you can do so for your dependents, so if you have parents that you care for, your children, and because all of this data is sitting on your mobile device, you can actually access all of that offline. So it doesn't matter if you're traveling or you have, I think one of the speakers earlier today was talking about how they ran out of mobile data earlier today on the way back from Penang. So even without mobile data, you can still access all of that. Now, we also wanted to see how we can make the patient journey better. So we've got an appointments feature. I think that's not too special today, but what we're working on is a referral loop, so that's connecting GPs with specialists and completing the loop where once you receive your treatment from the specialist, the GPs get some information back so that as your family doctors, there's that continuum of care when you go back for your GPs to continue treating you with all the information they require or need to help do that, right? And beyond that, we also have the ability to broadcast information so that you can reach out to your patients and share some good information with them. Now, what makes us kind of also unique in that field, going back to sort of the challenges of single patient, single electronic health record, right? Now, traditionally, what companies do is they have this big cloud where everyone's health data goes and sits on that cloud. But as I mentioned earlier, this time around, the individuals hold the data. Ring doesn't hold the data. We just transmit the data across to the patients. So with that, there's minimal use of cloud. People become responsible for their own data, and with that, it is you as an individual who chooses to whom, if you want to share your data, to whom you want to share your data with, and how much of that you wish to actually share with with other people. And we are also flexible. We can work with paper-based clinics or hospitals. We have a wonderful web portal which takes about 30 seconds of effort to actually transmit data across to your patients. If you have a tablet, you can quickly snap a photo if you're paper-based and you want to use paper-based records. But if you're digital and you have a clinic system or a hospital system, then we would love to integrate with your system so that it's completely seamless. There's no additional work for you as a doctor to actually transmit that information across. So overall, what we're trying to achieve is increasing the quality of healthcare provision, and that's just by allowing patients to share all of their data with their doctors. To increase customer satisfaction, because now I as a patient, the moment I walk out of the clinic or hospital, I know what's happened to me, and I'm able to build up that lifetime history. And there's process efficiency as well, right? So on the hospital side, rather than telling the patient, please come back after 2 or 3 working days to collect your records, they're able to receive it straight away, right? There's no one that's having to run around, get the doctor's signatures, the medical records team to approve, passing it on to the patient. This can all be done seamlessly now, directly from your system. So with that, I think there's a variety of different ways in which the app can be implemented. At its base, you can consider it sort of like a patient app where a patient's able to book appointments, you're able to reach out to your patients through our broadcast feature. But on a bigger scale, it's a perfect medical tourism app because all the data is sitting on the patient's device, so we're no longer bound by data sovereignty rules. We have the incoming e-referral platform as well. And in the Philippines, we're exploring it on a more governmental level, where it's going to become like a health hub app. And within that, it will start to generate a national health data bank. As we transmit data to patients, we can extract certain information that the government asks us to start building up their own health data warehouse, right? So with that, I thank you. If you guys are more interested either in reaching out or maybe checking out Ring for yourself, you can always do that from the little QR code here. And I'll be around, of course, to answer any questions. Thank you.
Thank you, Abhishek. Yeah. Does anyone have a question for Abhishek? Any questions? Oh, all right. Hold on.
Hi. Could you explain a little bit in real life practice, how does it work? Is it the healthcare provider that's keying in the data? Because you were to leave it to a layperson, then...
Of course.
Yeah, just a bit more on that. I did not get it from the...
Cool. So as I was mentioning, we have sort of 2 options. I'm sorry, I'm not sure what I'm clicking here. Sorry.
No problem. All right, thank you.
Essentially, if it's a paper-based clinic or if they're using our web portal, perhaps their clinic system or hospital system can't be integrated with our systems, then what happens is we have a web platform. You sign in. There's about 3 mandatory fields. It's the patient's phone number, which is how you reach out to the patient. You know which patient you're sending information to. Their diagnosis, so that we have ICD-10 codes, or it can be free text. There's a sort of additional remarks box if you want to add additional details for the patient. And then the sort of categories and tabs where you can upload files if you so wish to. Right, so that's on the paper-based side. It also gives you the option, if you're using a mobile phone or a tablet, if you're writing it out on paper, to just snap a photo of whatever notes you wish to share across. If it's integrated with an EMR, like a HIS or CMS, depending on the level of integration we're able to achieve, which we have a certain HIS that we're going to go live with, there's no additional inputs by the doctor. Of course, we make very clear to the doctor that these are the boxes from the EMR, or the fields that are going to flow directly to the patient, but essentially there's no additional work for the doctor to input that information.